We must do healthcare reform before the healthcare system dishes us. Let us put our emotions and fears out of our minds and consider only facts. Fact 1. Our medical knowledge, facilities, and technologies are probably second to none. That is, service-wise, we have the best medical system in the world. Fact 2. Our medical dollar probably gives us the least bang for the buck compared to any other country on this planet, maybe in the universe. That is, cost-wise, we have the worst medical system in the world. My observations: whether you are insured or not, healthcare for non-trauma or non-cardiac is mostly miss, and if you are very lucky, maybe a hit. Our medical care for non-trauma and non-cardiac is a sad money-making scam by hospitals and many of their associated doctors. And our governments condones these scams by not effectively regulating the medical professions. Fact 3. Our governments, whether it be federal, state, or local, is inept in regulating anything except for maybe TV repair shops and traffic and speed trap zones. Fact 4. Many governmental regulations are frivolous, useless, and costly to industries and common citizens. Many of these laws are not enforced. Sadly, some are enforced as revenue makers for said governments. Fact 5. President Reagan appeared at first to have the right idea, but the feds have taken it much too far, pleasing the fat cats that grease their palms. I have no doubt that many on Capitol Hill do not want to have dry palms. Rumor: hospitals are supposed to charge the same price for all patients. Hospitals give discounts up to 80% to large health insurance carriers covering their patients, while they charge uninsured patients 40 or more times the amount charged to the large insurance carriers. Rumor: I watched a news media report that a woman had good insurance for her medications. Because of her illness, she lost her insurance. She traveled to Mexico to purchase her drugs. The Mexico price of her medicine was only 10% of what she was paying under her insurance plan. What a rip-off! Paying premiums for the insurance, plus paying 10 times the price than the Mexico price. Fact 6. Our present medical system is badly broken and is not worth fixing. We need to start fresh. Rumor: if the public option is enacted, we, the average working citizen, will be paying for illegals' health care, and other deadbeats' health care. Matter of fact, we, the average working citizen, are already paying for illegals' health care and for the other deadbeats. The other deadbeats are many small entrepreneurs that pay near minimum wage and little or no health benefits. These are like large supermarket chains, large petroleum companies, gas stations, large department store chains, fast food franchisees, gas stations franchisees, and other franchisees. A lot of the franchisees pocket well over $250,000 a year per location. Rumor: the U.S. government cannot run anything efficiently. I think this is a myth. Just think what the cost of a first-class letter or a postcard would be without the U.S. Post Office as a mail/package carrier competitor. Do you think that UPS or FedEx would deliver anywhere in the U.S. or its territories for 42 cents? Conclusion: based on facts and believable rumors, healthcare reform must be radical. The health system is much too large for efficient governmental regulations. The free capitalistic system does not work without 10 to 15 competitors. We only have 2 or possibly 3 major competitors, so it cannot, and has not worked for more than 30 years. The public option plan may be the only answer, but knowing Congress's history, I think we are royally screwed and tattooed. The baby boomer author thinks the answer is to outsource Congress to India, or maybe Pakistan. Mexico and Canada are just too close to trust. President Obama has my permission to detain and imprison Congress. Offshore, of course. Written by R.A. Ray. Note: The statement and opinions stated in this presentation are not necessarily the opinion of the author, and this reader absolutely does not give a flying Mack duck truck